for children's health while they're navigating the recovery plan. So please join me in giving a very warm welcome to Dr. Mona Stone. We're thrilled to welcome you to the latest SK Conversations. This is Parents Playbook for Pediatric Pain Management. I want to say thank you to our partners at Pacira Biosciences Inc., the manufacturers of Exparel, for their help in bringing today's event to life. I have two boys, 12 and 17. They both play sports. So I know that as a parent and as advocates for our children's health, our most important and valuable tool is knowledge. And today we're going to be discussing how to prioritize our children's safety and explore leading non-opioid pain management options. But before we kick off our panel discussion and get to know our esteemed experts here, we want to play a short video that, as you'll see, highlights the importance of
Good morning, everyone. I'm Mona Stone. I'm an oral maxillofacial surgeon. My practice is in Westlake, Texas, which is in the suburbs of Dallas, DFW area. It's a very unique practice in the sense that I'm a solo practice, meaning I'm by myself, and I practice a full scope of my specialty. So I do a variety of procedures, including reconstructive facial surgery, like orthodontic surgery, as well as oral surgery procedures like Elizabeth. Can you guys hear me?
Yes.
Yeah, very good. I'm also mother of two children, Max and Sophia. They're 4 and 7, which is another reason why I'm super excited to be here with other moms and baby dads. Yeah. The point of this discussion today is really advocating for our children and for ourselves as patients. And so if we can be a champion of this discussion, then we've accomplished that goal. And I want to say that hopefully after today we can walk away feeling confident, feeling prepared, right? To be able to have those discussions with whoever is going to be the provider for your children or for yourself after a procedure or after an injury to make the recovery smooth.
My name is Paul Sethi. I'm an orthopedic sports medicine surgeon. I work in Greenwich, Connecticut as part of a large practice, 38 surgeons. I focus on youth athletes, sports injuries, ACLs, labrum tears, and shoulder injuries. And unfortunately, this is things that we see in athletes all the time. The reason I'm here today and my transformation over the past decade has been my growing frustration, sadness with the opiate epidemic that struck the United States. And for all of my life, I believe that I was a responsible steward of taking care of patients and pain medication. And I was frustrated. I said, well, who is doing this or how is it happening? But as it turns out, surgery is an inadvertent pathway to developing challenges and to developing dependencies. So over the past decade, we looked at pathways and developed ideas and created approaches towards surgery that can help us to, 1, better understand, 2, avoid, and 3, at a minimum, minimize the requirement for medications that have a potential downside. I mean, look, there's a role for them, but there's also a huge role for avoiding them in the right situations. And I guess that's why I'm taking my time to sit up here today and speak to y'all. I also am a parent and have youth athletes, and it hits home. Each time I see someone come in with an athletic injury that's going to disrupt their life, it means a lot to me.
All right, thank you. So as you can see, we are in excellent hands today.
Yes.
I think we're ready with our first video now.
Hi! So today I went to an event that was hosted by She Media. It was all about pediatric pain and opioids, and how terrible it is for children. And they have this new medicine, Exparel, and it's really, really good. If you're having to have some type of a surgery, and it's good for children or adults, if you're having knee surgery, hip replacement surgery, also for the main was for children was for when they have their teeth pulled, wisdom tooth and all that. This medicine is injected right into the site where the surgery is, and it lasts. It's like a slow release medicine that lasts for 72 hours because it's so important that children do not receive opioids for pain management because it's highly addictive to them. We understand anybody after surgery, we don't want to be in pain. Nobody wants their children to suffer. We don't want them to take opioids because it affects them too much. It just gives them a high that they've never felt before. And a lot of children that have athletic injuries, they get depressed because it's taken away from them, their sport. I'm an athlete. I play racquetball, and I hate when my arm hurts and I can't go and play. I enjoy it so much. So imagine a child, how devastating it is. And I really understand it. So they're already depressed. And if you give them opioids for the pain management, it could lead to addiction. So this new medicine, it sounds fantastic. It really, really does. I know a lot of people in my age group that need hip and knee replacements, and you can get this. You can request and demand this injection. You don't even feel it. It's done while you're asleep during surgery, and it lasts for 3 days. I highly recommend. I will put the name down below. You speak to your surgeon, pediatric, regular doctor. It sounds like a really good game changer in this opioid war that we have out there. It was really nice. I went to Sarah Beth's restaurant, which I've never been to before, and it was a thrill to go there because the Housewives of New York have eaten there so many times. So I got to go there, and they gave us a beautiful candle on the way out, and it's just beautiful. I even got to pick my color. They had white or blue, and I picked blue because that's my favorite color. So thank you so much, She Media, and I will spread the word about this new drug. And I have 1.5 million subscribers, so I will spread the word. I will do my part. Thank you very much for having me. And I'm going to include some parts of the show.